Hi, welcome back. Again, I'd like to invite all of you to call in with any questions or comments or concerns at 1-800-407-9487 or email us if you're watching at home on your computer. And now, Carolyn, you want to talk about your little assignment?
Yes, so I know that you all spent the break thinking about what Johnny is thinking about as he's tapping his pencil. We're waiting for those phones and emails so that you can tell us some of your thoughts. But in case you still think about it, I'll give you a few hints. Some of the things that he could be maybe not really even thinking about, but experiencing, is that he hears the dump truck outside, and no one else is really picking up on that noise. His pencil is broken. He has to go to the bathroom. The fellow in front of him has a red shirt on, and that just agitates him. He can feel or hear the vibration in the fluorescent lights or see the little blinking. He can't remember. Did she say we're doing math on page 5 and 10 questions, or page 10 and 5 questions, or was it, what was it about 5, or what did she say first? And was it math or something? You know, it's just an endless possibility about what is going on in his mind. You, as the observer, have to help him figure out what it is. Now, I was up in Canada in a one-room schoolhouse with teachers doing this demonstration, and one of the teachers laughed and said, last week, the fellow in the class who had been diagnosed with FAS, after she did just what I said, gave this review math assignment, sat back with his pen, tapping, and when she came and asked him why he didn't do his math, he said he couldn't. And she said, you did it yesterday. He said, I can't do it. So she said, why not? And he said, that tapping. She said, look at your pen. He looked down. He didn't connect. It didn't connect for him. So she stopped the tapping, and then he was able to go ahead and do his math. And I understand we have an email, and we'd like to see that. And also, Nispelem, yay, 11, thank you.
All right, great attendance, you guys.
That's
wonderful.
Great.
We have an email? Okay. There you go.
There you go,
Did the pencil
absolutely.
need to be sharpened?
Did the pencil need to be sharpened? That is a good thinking out there.
That's
I
right.
like this.
That could be
exactly
great
what he needed. Exactly.
Right.
And remember the story last week about the woman, the mother with FAS, whose children were in foster care, and the foster parents love her so much they bring her into the home with the kids a lot, and she was being paid $12.50 an hour to clean house for one of the foster mothers. Mother came home, again, house was spotless, everything great, orange juice on the kitchen floor. Foster mother said, gee, you did a great job cleaning, what's this? And she said, oh, orange juice. And she said, oh, why didn't you clean it up? And this woman said, well, it wasn't on the list. Yeah. And then she said, should I put it on the list? And the foster mother said, yes, she put it on the list. She cleaned it up and then checked it off like she did everything else.
That's right.
So.
Okay, we're going to move on to concepts of strategies, abstract kinds of concepts. And, you know, oftentimes in our clinic, we see children, you know, in the kindergarten, first grade, second grade, who are doing quite well in school. You know, they're not having a lot of problems yet, academically or socially. And then, boy, you know what, third grade hits. And if we could have the next slide, please. These are the kinds of things that happen in the curriculums, you know, when we start heading into third grade. And we really start looking at abstract kinds of concepts. And I don't know two more abstract concepts than time and money. And if you think about that, in third grade, they're starting to expect children to be independent. You know, what time is their recess? When do they come in? When are they supposed to go to lunch? How long is 15 more minutes? And they're starting to work with the concepts of making change and understanding what 5 nickels equals, or heavens, 2 dimes and a nickel, and you start mixing those kinds of change, and it gets to be really tough. Now, you know, I have a couple of children at home. Theodore actually is 17 years old, and if I were to give Theodore $5 and send him into the 7-Eleven store and say, you know, bring me out a loaf of bread, he can do that. He can go in and he could find the loaf of bread and he'll come out. But what I can't always depend on is, number one, that he'll even remember to get change, because money doesn't mean anything to him. He doesn't understand that. Or I also can't count on that it would be the correct change. It might be too much, it might not be enough. you know, whatever. Those are hard areas. And one of my other kids, Michael, now if anything costs more than $65, Michael thinks it's a ripoff, including your house and your, you know, car payments. If it's more than $65, he just doesn't, you know, that's more money than he can handle. And, you know, we expect those kinds of comments from our children when they're 4, 5, you know, even 6 years old. You know, the comments about, well, so what if you don't have any money, Mom? Just write a check. You know, we hear those from our younger kids.
Or
go to the cash machine.
Yeah.
But what the difference is that Michael's 12, and he still doesn't understand that you can't just write out a check, or you can't just go to the cash machine and, you know, get money, you know, out of the walls there.
Yeah, I mean, time and money, they're really both abstract and concrete. I mean,
That's
money's
right.
concrete. You can touch it. You can look at a clock. You can tell time. But the idea of time is also
That's
very
right.
abstract. I'm thinking about Danny. Danny cannot read that clock you saw in the slide. He cannot read a regular face clock. He can read a digital clock.
Mm-hmm.
Another young woman could not read that, the face clock or the digital clock, and was actually breaking her alarm clock every morning because it was waking her up. And that's what she said when they questioned her. Why are you breaking your alarm clock? Because she loved school, and the clock was getting her up to go to school. They got her a talking clock, a clock that says her name, why she's waking up. She now happily gets up, gets dressed, and go to school. But if you would talk to her about the concept of time, if you don't, I told you yesterday, Susie, if you don't clean your room today, you're not playing with your friends tomorrow. That will be meaningless to her.
That's right.
Absolutely meaningless.
Yep. And my daughter Tessa, who is, you know, almost 9, and I've talked a little bit about her. Tessa has a full-scale IQ of 110, and I mean that's well within the normal range. And yet, if I were to call home, you know, like on a break, and say I was out of town tonight, and Tessa would say, "Well, Mom, so when are you coming home?" If I say to her, "I'll be home tomorrow morning," I can bet that there's going to be some real heartache at my house, because Tessa does not understand the concept of tomorrow morning. And so what we have to do with our children, is, like with Tessa, if I break it down into bits of information and say, well, you know, now you came home from school and you're going to do your homework, and then Daddy will cook you dinner, and then you're going to take a bath, and you're going to get ready for bed, and then when you get up in the morning you're going to have breakfast, and then I will be home. Now she can handle those broken down pieces of time, because the way I'm describing them to her is something visual, and she can see that in her head. Now some of my children can't even do that, and so we need to take pictures actually of them doing those specific, you know, time frames, you know, doing their homework, eating dinner, taking a bath, getting up in the morning, and actually take pictures of them. And then the kids themselves will take that picture off of their board and move it over to the other column, and that means that it's done. And then they can see, and they can move down this kind of pictorial exchange, this board, and be able to see where they're at. So those are concepts that, you know, we really start to really press in second and third, especially third grade. Tessa is supposed to do occupational therapy, and every day, you know, the occupational therapist was getting upset. Her teacher was getting upset because she always had to remember to remind Tessa, or she wasn't getting there on time. Well, you know, Tessa doesn't. She can tell. She can read time. She can read a clock, but the concept of when 2 o'clock was is beyond her. And so what we've done for her at school is actually drawn a picture of a clock with the hands at 2, you know, one at 12 o'clock, one at 2 o'clock, and it's taped onto her desk in front of her. And then she just looks at the clock, and she looks at the clock on the wall and keeps comparing back and forth until the clock and the clock on her desk match the time. And then she knows that it's time to get up and to go to occupational therapy. But to understand the concept isn't there yet.
I mean, I met a 56-year-old woman who said that she hadn't been diagnosed, but she was absolutely positive that she had been affected by alcohol, as did all her brothers and sisters. She had a college degree. She had been a real estate broker for 10 years. She was very charming and very articulate, and wanted to be a lecturer in fetal alcohol syndrome. She came up to talk with me and couldn't tell me how long it would take her, because it was too many 15 minuses.
That's right.
Excuse me. Because she said everything happens in 15 minutes.
Yeah.
You know, and from Portland to Seattle was too many
15
minutes.
minutes.
So she couldn't tell me how long it would take her to get to my house. But she managed to get a college degree and hold a job for 10 years.
Yeah. Another area of difficulty for my children is organization. If we could have the next slide, please. You know, organization, and this is just a cartoon slide, but it really, I think, tells it well. And that's, you know, you just threw everything together. Matthews, a posse is something you have to organize. And organization is hard. You know, you need to be able to pre-plan. You need to be able to, you know, follow through. Organization is a high-level task, a high-level thinking task. And so in order for my children to be successful in this area at home, we actually have to modify the environment in order to allow them to organize as much as possible. And so when my kids come in the front door after school, we have 2 Rubbermaid containers that are sitting right there by the front door. And they walk in, and the first Rubbermaid container, their school shoes go in one, their backpacks go in the other. Now, the reason, it's not just to modify the environment to make my kids successful, it's to modify the environment so that it's easier for me too. Because if tomorrow morning came around and I was hunting through the house trying to find the match to Ricky's shoes, for example, it doesn't make for a pleasant morning when we're waiting for that school bus to arrive. So if they put their school shoes into the bin when they first come in the door, because what happens, my kids are also very concrete and things have to be the same for them. And so if I couldn't find that left shoe of his for in the morning, and I said, well, just put on your play sneakers, honey, it's okay, he would fall apart, because those are his play sneakers, and they're not the ones that are meant for school. So, you know, we organize things like that. We've also had to do, you know, some real modifications when it comes to what they can bring home from school and what they can't bring home from school. For example, library books. Library books are to be left at school in their desks, because I have 7 children in school, and if I, again, am looking for 14 books during the week and trying to figure out who belongs to who, and also, you know, I was going broke paying the fines because we couldn't find them, or because, you know, they left them out and the little guys were coloring in them or ripping pages. So the teachers were a little bit worried that my children would not be able to experience the or learn the skills of checking out library books, so we modified it, and they can check out library books at school, but then they need to leave them in their desks at school and read them there at, you know, on free time or at recess. And we have 250 books at home that if they lose them or color in them, that's, you know, the way it is. The next slide actually talks about, again, modification of environment. And it says, Mom, we were all singing She'll Be Coming Around the Mountain, but Randy won't stop with the whack, whack, whack part. Now, last summer, I took my 7 children and we got into my Chevy Astra van and we took off for a 30-day road trip. And we drove back to Wyoming and South Dakota and Minnesota, North Dakota, Montana, and all the way back home again, and visited our relatives and stuff back in the Midwest, and also, you know, spent some time on the reservations in Montana where some of my children are from. And I really thought that I had planned this, you know, vacation very well to make this as successful as possible. And before we left, I had bought all the kids either a CD or Walkman or a CD player, and they all had their little trays of tapes and CDs and their headsets. But what I didn't take into consideration, or I didn't think about, was that all of my children sing to their music. So by the time we stopped at the first rest stop, I had to stop and modify my own environment and buy earplugs because we were going nuts. So again, you know, that cartoon is just a little example of what it can be like in our van when we're driving down the freeway, but it's a good time. The next slide, if we could, is about what conscience is. And conscience implies the ability to understand cause and effect. And with this particular slide, you know, I want to challenge actually some of our social perceptions that we have in our country. One of them is that we learn right from wrong, and that we will learn from our mistakes and go on to not repeat them. And that's the way our whole judicial system actually is set up. You know, we believe in our country that if you get caught doing something wrong and we put you in juvie or we put you in jail, you are going to learn to not do that behavior again. And, you know, that's one of our social premises here in the United States. Well, my children, their ability to understand cause and effect or to generalize information from one situation to another is compromised. And, you know, it concerns me with, you know, especially within our state, which is a 3 strikes you're out state, that, you know, my children who don't get it and don't learn from their mistakes, we could have some serious ramifications. Now, don't get me wrong. I'm not saying that I don't, if one of my children did something that, you know, was a danger to someone else, or, you know, they committed armed robbery, or did end up growing up and hurt someone, you know, in one way, shape, or form. Don't get me wrong. I'm not saying that I want my children out on the streets to continue to hurt themselves or somebody else. What I am saying is that the systems that we have in place right now are not appropriate for my children. I don't want my kids to go into an adult system where they would continue to be exploited or victimized. We have some other social perceptions in our society and our country here that I think we need to think about too.
Can I just interject one thing, talking about the conscience issue? Many people say that our children don't have any remorse. And one of the things we're finding, having Dr. Coggins on the team at the University of Washington, who is a speech pathologist, is that it isn't so much about remorse. It's that our children they have a very difficult time putting themselves in someone else's shoes.
Right.
When asked to give the perspective of someone else in a situation, they really find it very difficult. I'm thinking about these boys that are incarcerated for murder, and like I said, when they were made to realize that they had ended life, they were very remorseful.
Yeah.
They felt terrible enough to try to end their own life.
That's right.
So we have to be very careful about the language we use and how we're really talking about the behaviors we're observing. One of the things I challenge you to do is to throw out all the psychobabble and the dis words and so forth, and just look at pure behavior. Just look at pure behavior and look at it in its context. Think about it in the environment.
That's right. If we go back to that, you know, slide, it's not that my children don't have a conscience. You know, I believe that my children do have a conscience, and my children are able to empathize, and my children do show remorse. But what is impacted, as far as my children goes, is their inability to understand or to link cause and effect, or to generalize from one situation to another. Now, some of the other social perceptions that I think that we need to challenge within our country and within ourselves, in addition to, you know, learning right from wrong, one of them is that by the time you reach the age of 18, that you should be well on the road to independence. Some of the next slides that I'm going to show here in a few moments actually talk about that oftentimes the children with fetal alcohol syndrome are about half their chronological age. So if we're thinking of, you know, independence at age 18 chronologically, but yet developmentally they're only at 9 or 10, we're really setting them up with unrealistic expectations. Another one of the misperceptions I think that we have, and this one I've thought about for a long time, but it's the issue of, you know, if we know an individual who has a physical disability that manifests itself in physical symptoms. So in other words, they're blind because they have retinopathy, or if they're hearing impaired because they need a cochlear implant, or if they're in a wheelchair because they have cerebral palsy. If they have physical symptoms of a physical disability, all of our systems accept that. They accept that person for who they are, including their disability. And in most cases, programs and, you know, plans and classrooms and all of that are set up taking into consideration and accommodating for those disabilities, for those systems. But we don't expect them to change, and we don't beat the blind child for not being able to read the blackboard. I mean, we do things like, you know, using ramps for the children who are in wheelchairs, and we use wireless FM systems for the children who are hearing impaired, and we use Braille for the children who are visually impaired. But when we have individuals who have a physical disability, like brain damage in this case, but that brain damage manifests itself in behavioral symptoms like problems with organization, or problems with judgment, or impulsivity, or distractibility, or not being able to link cause and effect, we have a much harder time within our systems and within our society accepting that person as a whole, including their disability. And instead we go in thinking, well, you know what, if we can modify that behavior, if we can change the behavior and make it go away, then we've cured the child. And then we wonder what happens, how come when we take away the supports and the structure, because it looks like they have modified their behavior, that pretty soon, you know, we're right back to square one.
You know, they often talk about this as a hidden disability.
That's right.
You know, I'm thinking I was called in on an IEP of a girl in elementary school, and twice actually, and we did get her all the services she needed, which did include an all-day aide for her. I just got a call from her mother saying that SSI was going to remove all of her assistants because she was cured.
Yeah.
And I said, fetal alcohol syndrome is not curable. Why do they think she's cured? Well, because she's doing really well in school now. I will guarantee that when the resources that that child has been getting to be cured are gone, she's going to be failing again.
That's
and
right.
it just amazed me that they didn't have that perspective of the hidden disability.
Right.
But in her case, she has fetal alcohol syndrome, so she is physically identified as someone with fetal alcohol syndrome, but still having to deal with this.
I know. It just amazes me. The next slide actually talks about the ability to predict what will happen next. And that, too, is an area that, you know, is difficult for our individuals with fetal alcohol syndrome and related conditions. You know, knowing that because I'm doing A today means that B this afternoon will happen in this particular way. It's very tough for our individuals with alcohol exposure to be able to do that.
Or if I'm going to punch Julie in the face, I bet you I have,
That's right.
I have an escape plan.
That's right.
Because I can predict what's going to happen next. Maybe not exactly, but I've got some idea that my action has a consequence. And this, and this again, is problematic for our children. I think this is one of the biggest problems that we see in all the children and their behavior, is that they either cannot or they have a great deal of difficulty doing that, connecting action and consequence.
Yeah, very hard. Now, I talked about, you know, our children being about half their chronological age. So these next slides are actually showing behaviors that are either appropriate for developmentally age appropriate versus age appropriate. And these slides were given to me or loaned to me by Deb Evanson, who is an educator in Alaska, and by Diane Mulbin, who is an educator and researcher down in Portland, Oregon. So if we could go through these slides, I want to talk about the typical development and the adaptive development. A chronologically aged expectations for a typical 5-year-old. They go to school. You know, typical 5-year-olds can follow 2 to 3 step instructions. They interact and they cooperatively play. In other words, they're not just doing the side-to-side kind of a stuff of play, the parallel play anymore. They are actually interacting with each other and playing cooperatively. They share and they take turns. Next slide, please. But if you have a 5-year-old who's going on 2 years, they still need to take naps, and they still need help from mom. They can only follow one instruction at a time, and they parallel play. Now, you know, if we walked into a preschool room or into a kindergarten room and we knew that that 5-year-old was developmentally only 2 or 3, we wouldn't worry so much at that point whether they were playing parallel, you know, play rather than interactive. But we need to know that. And boy, these kids are still really active. And it's also still that toddler thing of my way or no way.
And you know, just because we're talking about a 5-year-old here doesn't mean that you're not going to see a lot of these characteristics in the children as they age, and even in adults.
That's right.
The following one instruction, that may not change.
That's
they
right.
may always be someone who has to be given one instruction at a time.
At a time, exactly.
And you know, I was just thinking about Danny. I spent the day with Danny, and in one day he acted like a 14-year-old,
Yes.
which is what he was at the time. He also acted like a 2-year-old. We went to a beach and he got a container and he just sat under the spigot and filled it up with water and poured it out. He also, though, directed me successfully to every beach on Kauai and every lookout. One wrong turn the whole day. I was amazed. But he exhibited in different arenas, cognitive areas and social areas, different ages at different times during the day.
Well, and if we think about, there's actually 5 areas of, development. You've got your physical development, emotional, intellectual, social, and your morals and values. And you can be at different levels at the same time in all 5 of those areas. So, if we just look at a child and their physical development is on target, but that doesn't necessarily mean that we can expect that their intellectual or their social or emotional is
and that's
at
the
the same
hidden
level.
disability part we were talking about, where especially the child who is not exhibiting these facial characteristics and growth deficiency, and like Tessa, somebody who has an IQ of 110, they're going to present very well in many situations and look like everyone else. And again, there's that expectation.
That's right.
And I find even myself, I know a lot about this subject. I've worked with lots of different ages, and I've recently had a young woman in her early 20s in my home. And I, every once in a while, catch myself because she looks absolutely normal. She has, I think, a high IQ, and I catch myself in an expectation with her when suddenly I realize, oh, her brain is doing a detour right now, and so let's not push this. Let's go at it in a different way.
That's
so
right.
I know foster parents is frustrating.
I know it is, yes. And if we're looking at 6-year-olds going on 3, I think that first one's stretching it. I don't know many 3-year-olds even that can pay attention for about 10 minutes. But they need to be shown and they need to be reminded. And they don't wait very gracefully. It's come on, let's do it my way now. They act very impulsively, and they still need a lot of adult structure and reminders for tasks. And again, remember, just because we're talking here about 6-year-olds going on 3, this doesn't mean that even at 16, they might still be in the 3-year-old stages in some of these areas, like acting impulsively. Next slide, please. Developmentally age, 10 years going on 6 years. They might be just now beginning to read, but even now it's with the help of pictures or some other kind of contextual kinds of cues. They learn by doing, not by being told. And with our 10-year-olds, by the time they're 10 years old and they're in 3rd or 4th grade, most of the instructions that are happening in their classrooms now are verbal. They're not being done anymore by example or by allowing the child to do them, or to see them on the board. Most of the instructions are being done verbally, and that's pretty hard for 10-year-olds that are going on 6. They mirror and they echo words and behaviors. So that's, like I was talking about, social skills training being done in the appropriate arenas. So if you want to be cueing and intervening with a child who has difficulty with their personal boundaries in the hallways of the school, that's where you need to be doing the social skills teaching, is in the hallways of the school. Because otherwise, if you did it just in the classroom or in the counselor's office, it's very easy for them to mirror or just to parrot those words back to you. Typical, let's see, again, they still need supervised and structured play. My 10-year-old, this is where it's not that I have issues as far as their academic or classroom settings necessarily, as much as I have extreme concerns about what happens in their unstructured day at school, like on the playground or at lunch and recess time. They learn from modeled problem solving, and they're just now developing that sense of fairness. And this bottom one is so important. They are easily fatigued by mental work. My 10-year-olds, my 8, 9, 10-year-olds, when they get home from a full day at school, they're exhausted. I mean, it is very tiring physically and mentally, emotionally. I mean, they've been trying to deal with social stuff all day long, and they come home and they are exhausted. So for my kids and for me, the last thing that we need to do at that point is to sit down and do 3 or 4 more hours of homework.
And when they've been trying all day.
That's right.
And trying could mean maybe a C, maybe even an A if it's in a class that they have a strength in.
Right.
And maybe trying, studying all night for that test still ends in absolute failure. I saw a test where a girl came home from school every day and studied until 9:30. and still did not get one answer on the test correct.
Yeah.
Pick your battles. How much do you want to put your child through? I'm wondering if, I mean, many people are now homeschooling.
Well, and we have, you know, we have actually put it on the IEPs that my children will do 20 minutes of reading 5 nights a week, and at the maximum 20 minutes of homework, because my kids need to do the social stuff. We need to do the family things too. We need to be able to go out for dinner occasionally. We need to be able to go to the park. We need to go to Special Olympics and those other things. And those mean just as much as whether or not my children know the capitals of the United States.
And I mean, you have to plan success in their life.
That's right.
You have to make sure that they have more successes than failures.
That's right.
And if setting them in particular environments is always a setup for failure, then you go down and you change that IEP again, if it has to be changed.
There are some great videos out there by a man named Richard Lavoie, or Rick Lavoie, and he has a series of videos on children with learning disabilities. And one thing that he says is that the parents' primary goal is to make sure that your child has more poker chips at the end of the day than they started out with in the morning. And, you know, I just think that that's a great, you know, way of looking at it.
And I always say that my favorite parent is the one that when they walk in either the social worker's office or the teacher's classroom, they're sort of like, ah, here she is again, because that is the parent who's going to get the services. And particularly in school settings, your child has the right to an education.
That's right.
They have a right to an education, regardless of how that is patterned and structured for your child. They do have that right. There are problems on the bus and they can't solve them. Someone comes to get your child.
And, you know, I know for a fact, I don't even have to introduce myself at my children's schools anymore when I call on the phone. You know, I mean, they know me by my voice now, and I am sure that when they put me on hold to connect me or something, they're going, oh, gosh, this is Gelo again. Who's going to talk to her today? I know it. Okay, typical...
We encourage that.
We do. Typical 13-year-olds. They're responsible. You know, this next one just floors me, but truly, this is right. Typical 13-year-olds can organize themselves, they can plan ahead, and they can follow through. They can meet deadlines after being only told once. And they establish and maintain friendships. If you stop to think about 13-year-old girls, man, they can plan their phone calls. They know who's going to call when. They can even do conference calling. You know, I mean, but these are typical 13-year-olds.
I mean, I know you're sitting there looking at these and saying, oh, right, my 13-year-old, initiate and follow through. If it's something they want, absolutely.
That's right. You betcha they can. But 13 going on 8...
They don't even follow through on things that they want to follow through on. I remember Antonio Rathbun talking about a young girl who looked up on the refrigerator to see the invitation to a birthday party and asked her mother, Mom, was it Susie? Did I go to Susie's birthday? What did I get her? And it was 3 weeks away.
Yeah.
And, you know, she possibly could have not gone to the party just because she, again, doesn't understand time concepts and so forth.
So here we've got 13-year-olds going on 8. You know, they still need those visual cues. They need to be reminded. You know, and it doesn't always need to be, you know, explicit reminders. Sometimes it's just, Michael, what is it that you should be doing right now? Michael, where do you need to be right now? And that's enough for him to say, oh, yeah, that's right, I should be doing this. We need to have simple expectations. They still need to be prompted. 13-year-olds going on 8 are still very tactile. There's still lots of touching. They're still in your space, and they're just now learning about boundaries. And boy, this can buy our kids a lot of problems. You know, I mean, what is okay for 7- and 8-year-olds to do as far as, you know, touching your arm or wanting to even sit on your lap, we expect that, and it's okay with 6- to 8-year-olds. But boy, once you get 13, we look at that a little bit differently.
But you know, the positive side of that is a lot of the mothers have told me that they're sure that they have the only 14-year-old at school who will run up open-armed and hug them when they see them on the school grounds where, gosh, I remember walking to Alex's kindergarten class with him the first day and he said, don't touch me.
Now, adolescence is actually, next slide, is nothing more than stretch toddlers. Adolescents with fetal alcohol syndrome are stretch toddlers. Next slide. Typical 18-year-olds here we go. Here are these misperceptions, the ones that we think about for, typically developing 18-year-olds. They're on the verge of independence. They can maintain a job and graduate from school. They have a plan for their life. Now, this isn't all of them, but this is some. They can budget their own money, organize, and they can accomplish tasks independently in a variety of arenas, so both at home, school, and on the job. Next slide. But if you're 18 going on 10, you know what? You still need to have a limited choice of activities. You still need to have that structure and guidance. You're still in the here and now. We talk a lot about our kids being very Zen-like, I mean that they're very much in the here and now. They still do a lot of that giggling. They get an allowance because they're not able to earn their own money or to budget it. They still need a lot of help organizing, and they have boundary issues. So if we look at our children in those respects, though, as far as adaptively versus chronologically, it will, I think, again, go a long way to adjusting our expectations for our kids. So what do we need and what can we do? There are things that we can do, and there are things that we need. Our kids need structure. They need structure, and they need structure, and they need structure. There's no surprises for our children with alcohol exposure. Now, I don't mean by structure and consistency, I'm not talking about control. There's a difference there. But what I am talking about is not having surprises. Some of the worst days that my children will have is when they have a different bus driver in the morning than what they're used to, or they have a substitute teacher. Next slide. But we have general issues with all of our children, and ones that actually can go a long ways to having a positive outcome. If we have early adequate identification and diagnosis. One of the big things in Dr. Streiskuth's survey or program was early diagnosis before the age of 6. And then one of the biggest protective factors for these children was to be in a safe, stable, and structured home. The less moves, the better.
And this was at any age, even into adulthood.
That's right. Unrealistic expectations due to outward appearance and verbal gregarious manner. I love that one. I mean, Tessa's a great one for this. People see her, they see this cute, beautiful. I mean, she's not just cute, she's gorgeous, she's beautiful. And she's very, very verbal. She's been talking in complete sentences since she was 18 months old, and people expect things from her. And we need to have appropriate academic and vocational programs for our children. The state of Washington does provide for vocational streaming in our education, now hopefully by the age of 14, but for sure by the age of 16. But, I think that even in that case, it's, we're missing the boat. And that we should be looking at life skills kinds of academic programs for a lot of our children. Next slide. At least half of our patients with FAS exhibit these following, behaviors. And there's that maladaptive word. But it's poor concentration and attention, withdrawal, impulsivity, a high level of dependence, extreme anxiety, and lying, cheating, and stealing.
Which really are translations of their behavior.
That's
looking
right.
at it in a negative way.
That's
Again,
right.
Are they lying? Think about that other slide. Or are they just not understanding the reality they're in? Their memory doesn't allow them to remember what they were told to do. Are they cheating? Are they really stealing? Or did they think that was their backpack? Or didn't even understand that it was something that wasn't theirs? Well, gee, nobody was on that bicycle.
Yeah.
And or there were 10 candy bars, I just wanted one.
And that's, I think one of the challenges, for people is that we can change all of those phrases to something much more positive. But if we look at them in that negative bent, if we're always focused on their impulsivity, or if we're always focused on, that they're lying or cheating or stealing, there's where those 8 to 10 years of negative messages are going to come in for our children. What do our kids need, though? If you go to the next slide, they need unconditional love. Now, this slide isn't specific to children with fetal alcohol syndrome. I mean, all of us as human beings need these things. We need to have praise in our life. We need to have patience. We need to have consistency and structure. But our children with fetal alcohol syndrome and related conditions really need these kinds of things. These are,
and more often.
And more often. That's right.
And immediately. praise is now. It's not at the end of the day
Yep.
saying, I was so proud of you this morning when you tied your shoes. They may not have a memory of this morning or tying their
That's
shoes.
right.
So it has to be immediate praise, as well as immediate there's lots of different words. I don't believe in punishment. Even discipline is one of those words. But it's just creating structure for them to be safe in,
Right.
and for them to do the right thing in, but making them aware all the time. This is not the right action. This is the right action, and having that happen right now, not later. Telling the child to go to the principal's office after school probably will not result in going to the principal's office after school. They'll come back the next day and be in trouble for whatever it is they did in the class to get in trouble. Probably won't remember that. Certainly won't remember being told they were to go to the principal's office. Now they're really in trouble.
They're really in
and
trouble.
They get frustrated, and some of them get angry.
Yep.
Some of them get very sad and are very sensitive about these things because, once again, they're always doing something wrong. They're always the bad guy. And that's not their motivation most of the time.
That's right.
But they are also children.
And you know what, I mean, don't get me wrong, I'm not saying that my children should not be held accountable for their behaviors. We do hold them accountable for their behaviors, and you know, I ask the teachers to hold them accountable for their behaviors. But the accountability and the consequences need to be as logical and natural as possible, and as quickly after the incident as possible. And then finally, I want everybody, all the adults in their lives, to know that even though we hold them accountable, we can't make them responsible. There's a difference between holding them accountable, making them responsible. Because if we think that the consequence that we give them today is going to change their behavior tomorrow, then we're setting ourselves up and we're setting them up for a hard time.
I mean, if they're taking change off of your dresser every day, don't leave the change on the dresser. Take it away.
That's right. The next slide is tools of the trade, and you know, we all know these. It's compassion, enlightenment, persuasion, and diligence. And I think we also need to add on here sense of humor. You know,
Amen.
If we can't laugh about some of these things, we will go crazy and we will have a burnout. Now, the next 3 slides, these are actually just a quick little test. So I don't want to scare you, but if we can have the next slide, please, I want you to study this now. And this is going to be, we're going to have a little pop quiz here in just a couple of seconds. And then this is going to lead us into our break here very soon. So you need to memorize these things. You know, Johnny, I need you to sit still in your desk. Stop tapping your pencil.
Johnny's bugging me.
And Tessa, would you just sit still
I don't have a piece of paper
and
or a
listen.
pencil.
Okay, the next slide, please. This is our test. Now, I want you to write down your answers quickly,
What did you say?
fast, efficiently, because this is going
What
to be,
answer?
we're going to have our break here very soon. Okay, next slide, please.
Next slide.
Next slide. All right, there you go.
Hey, tic-tac-toe.
This is our answers. Now, what I want you to look at is to think about, if I had showed you this slide first, and then if I could have you back up 2 slides, please, then to this one, and then given you the test, would that have been easier?
And also, I was chatting in the background because our kids are so sensitive to things that we're not even aware of.
We're not even aware of.
People shuffling paper and moving their pen around the
Right.
desk and talking with each other and so forth and
That's
so on.
right.
Test environments are very stressful, and at clinic, the kids do probably the
They do
best they're
quite
going
well
to
in our
do
clinic.
on a test because they're in a room that's quiet without distractions and one-on-one. And we have a call from Clarkston. Hello there.
Hi.
Hi.
You keep referring to your clinic.
Yes.
And the question we'd like to know is what is done at the clinic for diagnosis? What are the steps and what procedures done and who would attend?
Okay.
Yeah, well, first of all, we have cloned the clinic so that it exists in 6 or 7 different places in the state. Dr. Claren and Dr. Astley, who co-direct the clinic, at the University of Washington have trained teams. Now, those teams may operate slightly differently than the team at the University of Washington, but they've gone through the training and they approach the diagnosis the same. There's actually a manual that Dr. Astley and Dr. Claren wrote on how to do this diagnosis. You are given a patient information form that's quite lengthy, asks a lot of questions about not only the child, but the birth parents and their relatives, not just about alcohol and substance abuse, but sexual abuse, learning problems, cognitive problems, emotional problems, so on and so forth. Then it's going to rely a lot on your observation. One of the things I suggest is you keep a journal. Keep a journal of your child's behavior. You may also start seeing patterns of behavior that happen at certain times of the day or the week or even the month or year. That is sent in and with pictures, and we want non-smiling pictures because what we're looking at is this thin upper lip and no philtrum, and when you smile, the lip is thin and the philtrum becomes vague or disappears. So we want frontal pictures of children not smiling, which is difficult for our little kids because
they smile a
they like
lot.
to smile. That is sent in with any testing that's ever been done, counselors' reports, medical records, anything that will help us put this puzzle together. It is like a 1,000-piece jigsaw puzzle, and at best we get 500 pieces to put together. So the more information we have, the better it's going to be for diagnosis. Then the family comes in with the child. The child is separated, and the speech pathologist and the occupational therapist will test the child. The psychologist will do some testing. In the meantime, one of the psychologists and the doctor are talking with the parents, going over the behaviors, asking and answering questions. Then the child's brought in and the doctor does a physical exam. They're looking for things like problems rotating at the elbow, sometimes a curved spine, rotated and low ears, a crease right here called the hockey crease because they've been in utero, sort of anesthetized in this position and not moving around. Our moving around in the womb gives us all those creases. So this exam, this is a 3-hour exam. All this is done, then the information is taken in by the team to a room without the family. The diagnosis is discussed and made. The family is brought in, usually without the child, but that's up to the family. And they're given the diagnosis, and then the psychologist goes into a small room with the family where they can really debrief. This can be very emotional, whether it's birth or foster or adopt parents. They can also ask more questions. There are resources given, ideas about what other things might need to be looked at. Some of the children end up needing particular kinds of surgery or more neurological testing, psychological testing, genetic testing, so forth and so on. There is a number that everyone in the state will access, even if you're wanting to see the clinic in Spokane, for instance. You would still call the Seattle number, which is 206-526-2522. So did I miss any part of your question?
No, you did. I just have one more addition to
Sure.
it, though.
Okay.
If a child's on medication for ADHD, would the child stay on the medicine, or should it be taken off before the
okay. Do we have 4 or 5 more hours?
No.
Go for it, Julie.
Leave the child on the medication because truly what we want to be able to do is to give the child the most opportune environment for testing, and if they are climbing the walls or not being able to sit still for 30 seconds, then we aren't going to be able to get an accurate picture of what their ability is as far as speech and language or occupational therapy or neuropsych. So at this point in time, the recommendation from our physicians is to leave the child on the medication that they are on prior to coming into clinic.
Thank you for that question. We also have one now from Long Beach.
Thank you.
Long Beach?
Yes. Can you please tell us where the nearest clinic is to us here in Long Beach?
You're in Long Beach. Federal Way. Could you step away from the mic just a minute? You're causing just a little bit. Okay. The nearest clinic to Long Beach would be in Federal Way.
All right.
We are at this point, though, there is a team that's working on putting together a site in Vancouver, Washington.
All right,
but we haven't gotten it all finalized yet.
But you would still access it by calling that 206-526-2522 number. And we have an email. You're all awake out there and responding. We love it.
Thank you.
Let's see our email.
We have an email question. The information I have about the family is very sketchy. How could she be tested with so little information? Again, this is my adopted child that we have had since 1 month of age. Know that mom did use alcohol and may have used some drugs, but not sure what. We know even less about the natural father. You know, this is not an unusual circumstance, and oftentimes we know very little about the father, sometimes nothing about the father. And all you can do is to give us the information that you have. And if we're finding that there is information that's lacking and we really do need to have something, somebody within our clinic would call you back and let you know that, you know, gee, can you find out more about the prenatal history, or can you check on the birth records or whatever, and then, you know, try and help you maneuver through the systems to be able to get the information that we need. Sometimes it's a matter of going back to the birth records or finding a caseworker or whatever from that first month. But, you know, we can only do what we can do, that including you. So that would be, you know, you can initiate the process, get the paperwork, fill it out to the best of your ability, and then send it in with the information that you have, and then we can just go from there. Mm-hmm. Okay.
Well, it's 8 o'clock. I don't think we're going to give you any homework. You get to have a